When managing diabetes, we often focus on carbohydrate restriction, medication adherence, and glucose monitoring. However, there's an equally important component many diabetics overlook: essential nutrients, particularly vitamin D. For diabetics, vitamin D is far more than just a bone-supporting supplement. It plays a critical role in insulin function, inflammation regulation, nerve health, and organ protection. Unfortunately, diabetics face multiple barriers to maintaining healthy vitamin D levels. Insulin resistance and chronic inflammation, hallmarks of diabetes, interfere with vitamin D metabolism. High blood glucose and increased urination can flush vitamin D from the body before it's properly utilized. Many diabetics also spend insufficient time outdoors, reducing their natural sun exposure, the primary source of vitamin D production. Age compounds these issues, as the aging pancreas and liver struggle to activate vitamin D effectively. A vitamin D deficiency manifests through several warning signs: persistent fatigue, muscle weakness, bone pain, delayed wound healing, numbness, frequent infections, and cognitive fog. Some individuals may experience increased sugar cravings, mood fluctuations, or unexplained inflammation, all potentially linked to insufficient vitamin D. When vitamin D levels drop too low, multiple body systems suffer. Reproductive health declines in both men and women. Men experience reduced testosterone and diminished sperm quality, while women face disrupted ovulation and estrogen imbalances. Sexual desire often decreases as testosterone levels fall. The nervous system becomes particularly vulnerable. Vitamin D is essential for nerve repair and protection, and deficiency can worsen diabetic neuropathy, increase tingling sensations, and slow reflexes. Kidney function suffers as vitamin D plays a crucial role in calcium balance. Without adequate levels, the risk of kidney stones and chronic kidney disease rises significantly. Vision health deteriorates as well. Low vitamin D contributes to diabetic retinopathy by allowing excessive inflammation and oxidative damage to the retina's delicate blood vessels, potentially leading to progressive vision loss. Cardiovascular health is also compromised. Vitamin D deficiency correlates with hypertension, arterial stiffness, and atherosclerotic plaque formation, all significant risk factors for heart attacks and strokes in diabetic patients. At the cellular level, vitamin D functions as a regulatory switch for insulin sensitivity. It binds to vitamin D receptors on pancreatic beta cells, enhancing insulin production and release. In muscle and fat tissues, vitamin D improves glucose uptake by activating insulin receptors and glucose transporters. Moreover, vitamin D regulates the immune system, reducing the chronic inflammation that contributes to insulin resistance. It also protects beta cells from autoimmune destruction and oxidative stress, preserving the pancreas's insulin-producing capacity. For optimal diabetes management, maintaining adequate vitamin D levels is essential. Blood testing can confirm your status, with ideal levels generally between 50 to 80 nanograms per milliliter. While sun exposure provides natural vitamin D, many diabetics benefit from supplementation under medical supervision, typically 2,000 to 5,000 IU daily, depending on individual needs. Dietary sources, though less potent than sunlight or supplements, include fatty fish, salmon, mackerel, egg yolks, fortified dairy products, and mushrooms exposed to UV light. By addressing vitamin D deficiency, diabetics can potentially improve insulin sensitivity, reduce inflammation, protect vital organs, and enhance overall energy levels, making diabetes management significantly more effective and reducing the risk of serious complications. While vitamin D plays a crucial role in diabetes management, vitamin B12 represents another essential nutrient that diabetics frequently overlook. For those with diabetes, B12 deficiency risk is significantly elevated, often occurring silently while causing widespread systemic damage. Metformin, the first-line medication prescribed to millions of diabetics worldwide, presents a double-edged sword. While effectively managing blood glucose levels, it simultaneously impairs B12 absorption in the intestinal tract. This medication-induced malabsorption creates a gradual depletion of B12 stores that can remain undetected for years until reaching critically low levels. The challenge extends beyond medication effects. Chronic hyperglycemia damages the stomach lining, compromising production of intrinsic factor, a protein essential for B12 absorption. This creates a perfect storm where the very condition being treated, diabetes, exacerbates nutrient deficiency. Age compounds this issue, as natural stomach acid production decreases over time, further reducing B12 absorption efficiency. What makes B12 deficiency particularly insidious is its gradual onset. Rather than presenting with acute, obvious symptoms, it manifests incrementally, with effects often misattributed to aging, diabetes progression, or other health conditions. This delayed recognition allows deficiency to progress unchecked, potentially causing irreversible damage. Neurological manifestations represent the most concerning aspect of B12 deficiency for diabetics. The peripheral neuropathy commonly attributed solely to diabetes, characterized by tingling, numbness, burning sensations, and pain in extremities, may actually be exacerbated or primarily caused by insufficient B12. This vitamin is crucial for maintaining myelin sheaths, the protective covering around nerve fibers that ensures proper signal transmission. Beyond neuropathy, fatigue often signals B12 deficiency. This isn't ordinary tiredness but profound exhaustion that persists regardless of rest. The underlying cause lies in B12's essential role in red blood cell formation and oxygen transport. Without adequate B12, megaloblastic anemia develops, reducing oxygen delivery to tissues and creating persistent fatigue, dizziness, and shortness of breath. Cognitive function suffers significantly with B12 depletion. Memory lapses, confusion, difficulty concentrating, and overall mental fogginess can progress to the point where some individuals fear dementia development. These cognitive changes occur because B12 is necessary for neurotransmitter production and maintenance of brain health. Studies have shown connections between long-term B12 deficiency and increased risk of cognitive decline, particularly in diabetics already vulnerable to vascular dementia. For men, reproductive health faces serious consequences from B12 deficiency. Sperm quality deteriorates, characterized by reduced motility and abnormal morphology. Testosterone production decreases, affecting not only fertility but also libido, muscle mass maintenance, energy levels, and overall vitality. This hormonal disruption creates a cascade of physical and psychological effects that significantly impact quality of life. Addressing B12 deficiency requires a multifaceted approach. Dietary sources provide the foundation, with animal products containing the most bioavailable forms. Clams stand out as an exceptional source, with a 100g serving providing over 7,000% of the daily requirement. Liver, beef, or lamb delivers approximately 1,000% per 100g serving, while wild salmon, sardines, and nutritional yeast offer significant amounts. High-quality eggs, particularly from pasture-raised chickens, provide moderate B12 alongside complementary nutrients. For those requiring supplementation, several forms exist with varying bioavailability. Methylcobalamin represents the most active, readily usable form, particularly beneficial for those with compromised absorption or genetic methylation issues. Hydroxycobalamin offers excellent retention in tissues with sustained release characteristics. Adenosylcobalamin specifically supports mitochondrial function and energy production. Sublingual B12 supplements bypass digestive barriers, delivering the vitamin directly into the bloodstream through the mucous membranes. This administration route proves particularly valuable for diabetics taking metformin or those with gastrointestinal absorption issues. Injectable B12, available through healthcare providers, provides the most direct method for rapidly correcting severe deficiencies. Beyond supplementation, certain lifestyle modifications support B12 utilization. Reducing alcohol consumption improves intestinal absorption and liver function. Addressing potential gut dysbiosis through probiotics and digestive enzymes enhances nutrient extraction efficiency. For those continuing metformin therapy, working with healthcare providers to establish appropriate monitoring and supplementation protocols prevents deficiency development. Regular B12 monitoring through comprehensive blood testing represents an essential component of diabetes management. Serum B12, methylmalonic acid, and homocysteine measurements provide a complete picture of functional B12 status beyond standard testing. By recognizing and addressing B12 deficiency, diabetics can potentially reverse neuropathic symptoms, improve energy levels, enhance cognitive function, and prevent irreversible neurological damage, transforming their management approach and quality of life. For diabetics focused on blood sugar management, folate, vitamin B9, represents a critically important yet frequently overlooked nutrient. Unlike fat-soluble vitamins that can be stored in body tissues, folate requires consistent replenishment through diet or supplementation, making regular intake essential for optimal health. Diabetes creates multiple mechanisms that contribute to folate deficiency. The chronic hyperglycemic state generates persistent inflammation and oxidative stress throughout the body, directly interfering with folate metabolism at the cellular level. These inflammatory processes disrupt the conversion of dietary folate into its active form, methyltetrahydrofolate, MTHF, reducing its biological effectiveness even when intake appears adequate. Metformin, while beneficial for glucose control, creates an additional folate absorption barrier. Research demonstrates that this widely prescribed medication inhibits folate uptake in the intestinal tract, gradually depleting reserves over time. This medication-induced malabsorption compounds the natural metabolic challenges diabetics already face. The polyuria, increased urination, characteristic of poorly controlled diabetes, accelerates folate depletion. As a water-soluble vitamin, folate is readily excreted through urine, and the increased urinary output associated with hyperglycemia leads to significant losses. This creates a situation where diabetics simultaneously struggle with absorption while experiencing accelerated excretion, a perfect storm for deficiency. Folate deficiency manifests through symptoms that overlap significantly with common diabetes complications, making identification challenging without specific testing. Profound fatigue, muscular weakness, and delayed wound healing, all typically attributed to diabetes progression, may actually signal insufficient folate. Cognitive impairments, including memory deficits, concentration difficulties, and general mental fogginess, frequently develop, often misattributed to aging or vascular dementia rather than nutrient deficiency. When folate levels fall significantly, megaloblastic anemia develops, characterized by abnormally large, immature red blood cells with reduced oxygen-carrying capacity. This manifests as pallor, dizziness, tachycardia, and dyspnea even with minimal exertion. The resulting tissue hypoxia further compromises already vulnerable diabetic tissues. Beyond these general manifestations, folate deficiency impacts multiple organ systems. For women of reproductive age, inadequate folate significantly increases risks during pregnancy, including neural tube defects, preterm delivery, and gestational diabetes complications. Even in non-pregnant women, folate deficiency disrupts hormonal balance and menstrual regulation. The nervous system relies heavily on adequate folate. This nutrient is essential for myelin maintenance, the protective sheath surrounding nerve fibers. Without sufficient folate, peripheral nerves deteriorate more rapidly, exacerbating diabetic neuropathy and accelerating sensory loss. Centrally, folate deficiency contributes to cognitive decline, mood disturbances, and increased dementia risk. Cardiovascular health faces particular challenges with folate insufficiency. Low folate leads to elevated homocysteine, a known independent risk factor for cardiovascular disease. This amino acid damages arterial walls, promotes atherosclerotic plaque formation, and increases thrombosis risk. For diabetics already predisposed to cardiovascular complications, this represents a significant additional burden. At the cellular level, folate serves critical functions that directly impact diabetes management. It participates in DNA synthesis and repair, supports cellular division, and enables proper protein metabolism. Perhaps most importantly for diabetics, folate plays a central role in methylation processes that regulate gene expression, detoxification pathways, and neurotransmitter production. Folate works synergistically with vitamin B12, creating a metabolic partnership where deficiency in either nutrient compromises the functionality of both. This B vitamin interdependence means that addressing folate alone without considering B12 status limits therapeutic effectiveness. To maintain adequate folate levels, dietary sources provide the foundation. Dark leafy greens lead the nutritional pack, with spinach providing approximately 260 micrograms per cup, 65% DV, and kale offering 100 micrograms per cup, 25% DV. Cruciferous vegetables, including broccoli, Brussels sprouts, and cauliflower, deliver substantial folate alongside beneficial fiber and antioxidants. Legumes represent another exceptional folate source, with lentils providing 358 micrograms per cup, 90% DV, and chickpeas delivering 282 micrograms per cup, 71% DV. Asparagus stands out among vegetables, with just 4 spears providing 85 micrograms, 21% DV. Avocados contribute 120 micrograms per fruit, 30% DV, while simultaneously providing healthy monounsaturated fats that support insulin sensitivity. Animal sources, including liver and egg yolks, provide modest folate amounts alongside complementary nutrients like B12. Citrus fruits, including oranges and grapefruits, offer bioavailable folate with vitamin C that enhances absorption. For those requiring supplementation, selecting the proper form proves crucial. Methylfolate 5-MTHF represents the most bioactive form, bypassing conversion steps that may be compromised in diabetics. This form proves particularly valuable for individuals with MTHFR genetic variations that affect folate metabolism, a condition more prevalent among diabetic populations. Dosage requirements vary based on individual needs, medication use, and genetic factors. While the standard recommended daily allowance is 400 micrograms, diabetics taking metformin or experiencing absorption issues may require higher therapeutic doses under healthcare supervision. By addressing folate deficiency through dietary modification and targeted supplementation when necessary, diabetics can potentially improve energy production, enhance wound healing, support nervous system function, reduce cardiovascular risk, and optimize overall metabolic health, transforming their diabetes management approach from glucose-centric to comprehensively nutritional. Beyond its general health benefits, folate functions as a master cellular regulator with profound implications for diabetes management. This crucial B vitamin operates at the molecular level as a metabolic facilitator, influencing multiple pathways that directly impact glucose metabolism and tissue integrity. At its core, folate serves as a cellular construction worker, facilitating DNA synthesis, repair, and cell division. In diabetic tissues, frequently damaged by hyperglycemia, this regenerative capacity becomes essential for maintaining functional integrity. Folate deficiency compromises cellular repair mechanisms, accelerating tissue deterioration and increasing oxidative stress, a damaging process already heightened in diabetic patients. The inflammatory cascade represents another critical area where folate exerts significant influence. Diabetes creates a state of chronic low-grade inflammation that damages tissues throughout the body. Adequate folate helps regulate inflammatory pathways by supporting methylation processes that control gene expression of inflammatory mediators. Without sufficient folate, this regulatory function falters, allowing unchecked inflammation to progress. Insulin sensitivity, the cornerstone of effective diabetes management, responds directly to folate status. Research demonstrates that optimal folate levels enhance cellular responsiveness to insulin by improving receptor function and post-receptor signaling pathways. This translates to more stable blood glucose levels and potentially reduced medication requirements over time. Vascular health represents a particular concern for diabetics, who face accelerated atherosclerosis and microvascular complications. Folate maintains vascular elasticity by promoting nitric oxide production, a vasodilator that prevents arterial stiffening. This flexibility preservation proves essential for preventing hypertension and ensuring adequate perfusion to peripheral tissues, particularly extremities vulnerable to diabetic complications. For male diabetics, reproductive health faces particular challenges with folate deficiency. Sperm DNA integrity deteriorates, characterized by increased fragmentation and reduced repair capacity. This manifests as decreased sperm motility, abnormal morphology, and reduced fertilization potential. The resulting subfertility compounds the emotional and psychological burden already experienced by many diabetic men. Female reproductive health depends heavily on adequate folate. Oocyte quality, essential for successful conception and embryonic development, requires folate for proper DNA replication and chromosome segregation. Hormonal regulation, particularly estrogen metabolism, relies on folate-dependent methylation pathways. For diabetic women already facing reproductive challenges, folate insufficiency exacerbates fertility difficulties and increases pregnancy complication risks. Sexual function in both genders suffers with inadequate folate. The vitamin's role in nitric oxide production directly impacts erectile function in men and genital blood flow in women. Beyond physiological effects, the fatigue and mood disturbances associated with folate deficiency further diminish libido and sexual satisfaction. Neurological health represents one of folate's most critical domains. The vitamin participates in neurotransmitter synthesis, particularly dopamine, serotonin, and norepinephrine, directly affecting mood regulation and cognitive function. Myelin sheath maintenance, crucial for nerve signal transmission, requires adequate folate. Without sufficient levels, neuropathic progression accelerates, cognitive performance declines, and mood disorders develop or worsen. Kidney function, already vulnerable in diabetics, faces additional challenges with folate deficiency. Elevated homocysteine resulting from insufficient folate damages glomerular structures, accelerates basement membrane thickening, and promotes mesangial cell proliferation, all pathological changes characteristic of diabetic nephropathy. Maintaining optimal folate levels helps preserve renal function and slows nephropathy progression. Ocular health depends significantly on adequate folate. The vitamin supports retinal microcirculation by preventing homocysteine-induced endothelial dysfunction. It also participates in antioxidant defense systems that protect retinal tissues from oxidative damage, particularly important given diabetics' elevated risk for retinopathy and macular degeneration. Cardiovascular protection represents perhaps folate's most researched benefit. By converting homocysteine to methionine, folate prevents this amino acid from damaging arterial walls and promoting atherosclerotic plaque formation. Additionally, folate supports proper cholesterol metabolism reduces inflammatory marker expression, and improves endothelial function, all critical factors for cardiovascular health and diabetes. Addressing folate needs begins with dietary optimization. Organ meats represent the most concentrated source, with beef liver providing 140% of daily requirements per 100 g serving. For those preferring plant sources, spinach delivers 65% per 100 g cooked portion, while lentils offer an impressive 90% per 100 g. Asparagus, 35% per 100 g, and avocados, 25% of medium fruit, provide moderate amounts alongside beneficial fiber and healthy fats. Culinary enthusiasts can incorporate gourmet folate-rich options, including truffle-infused risotto with asparagus and spinach, 120% daily value per serving, or miso-marinated black cod with edamame puree, 100% daily value. These sophisticated preparations deliver therapeutic nutrient levels while supporting overall metabolic health. When supplementation becomes necessary, methylfolate, the bioactive form, offers superior effectiveness compared to synthetic folic acid. This distinction proves particularly important for diabetics, whose metabolic challenges may impair the conversion of folic acid to its active form. Quality supplements providing 800 to 1,000 micrograms methylfolate daily typically address deficiencies effectively when taken consistently. Several factors deplete folate reserves or block absorption. Processed grains lose folate during refinement processes. Excessive alcohol consumption disrupts folate metabolism through multiple mechanisms. Diets high in refined sugar increase oxidative stress, depleting folate more rapidly. Medications, including metformin and proton pump inhibitors, interfere with folate absorption and metabolism. By prioritizing folate through strategic dietary choices, appropriate supplementation when indicated, and avoiding depleting factors, diabetics can potentially transform their disease management approach. The resulting benefits extend beyond basic nutrient repletion to include enhanced cellular repair, improved insulin sensitivity, reduced inflammation, preserved organ function, and significantly improved quality of life, making folate a cornerstone of comprehensive